Hey, what's going on? I'm Dr. Leila Hariri, a family and cosmetic dentist for more than 22 years. And you're listening to Ask Dr. Leila. Anything you need to know about dentistry. We're going to talk about teeth, prevention, oral health, and tons more. So relax, listen, and smile. A very good morning to all of you out there. It's nearly the end of the year. We made it. And it's a good time for reflection upon all the things that we're proud of and the ones that we're not so proud of. But we know that we can improve in the new year. Anyhow, looking forward, I hope that first of all, it's filled with lots of health for yourselves and your loved ones, and happiness and prosperity. Today's topic at our podcast is dentophobia, fear of dentists. And this is something that we see more often than not. Actually, I'm not sure that we're just not liked as dentists or there's a fear of us. A combination of both, really, in all honesty. But there is a lot of fear. And I've always been told that there's two specialties, medical specialties that people really hate to go to. And for women, actually, it's the OB and the dentist. And I think it holds true. I think it's because the position that you guys lie in on your back, you basically feel the loss of control. And of course, your mouth is open for long periods of time. And some people have a hard time breathing through their nose. So all of this causes, some anxiety, anticipating the unknown. I get it completely because even myself, when I lie on that dental chair, I don't know what happens to my physiology, but my heart starts beating faster. And I have to just, keep on breathing and do, the techniques that I know. And hence why we're always counting. I think when we give you a time frame that we say, okay, 10 seconds, we're going to count to 10, or just the fact that we're counting, that there's an end. And I think me and my assistants are just good at, kind of just rubbing the shoulders and, making you feel that we're there for you. And just that pampering also helps. And of course, if you're extremely fearful, then introducing what you're about to do, talking about it in small increments, and staying true to your words really helps. Okay, so dentophobia. Dentophobia is a fear of the dentist. People with this specific phobia feel anxious when they think about going to the dentist or actually visiting the clinic. Past negative experiences, and that's huge. And I have a lot of people in my generation have had horrible experiences because back then either people were not using the anesthetic as readily as they should have, or just dentistry was not the same as it is today. It was just get the job done. But now we look at you guys as holistic, and that's how it should be. You could also have a family history that causes dentophobia. But as I mentioned before, it's the feeling of loss of control. Exposure therapy, guided imagery, and relaxation techniques help overcome this disorder. People with dentophobia, it's also called odontophobia, have a fear of dentists. Someone with dentophobia may have extreme anxiety at the thought of going to the dentist or while in the dentist's office. Phobias are a kind of anxiety disorder. They lead to excessive fear of an event or situation that isn't actually harmful. So let's keep that in mind, isn't actually harmful. Dentophobia is a type of specific phobia disorder, a specific situation that is related to the dentist only or going to the dentist that leads to a fearful response. What is the difference between dentophobia and severe fear of dental treatment? Dentophobia is an extreme fear that's out of proportion to the situation. People with dentophobia avoid seeing the dentist even when they're in pain. This condition is so severe that it can lead to very poor dental health. These problems may affect a person's relationships or job prospects. Severe fear of dental treatment involves feelings of distress, but these feelings aren't as extreme as dentophobia. People with dental anxiety worry a lot about pain or stress at the dentist, but will likely still see their dentist for treatment, unlike those with dentophobia. How common is dentophobia and dental fear in general? About 36% of people in the US have a fear of dental treatment, with 12% having an extreme fear. 3% of adults in industrialized countries may have dentophobia and avoid going to the dentist at all. Fear of dentists is more common in females than in males. Some studies suggest that nearly 3% of men and almost 5% of women have this condition. So, what does a person with dentophobia fear? They may be afraid of the anesthetic. People usually aren't fearful of getting an anesthetic, the numbing drug, but instead fearing that the anesthetic may not work. Some people fear side effects of the anesthetic, such as temporary numbness of their lips, but that's rare. It's usually they feel that, what if I still sense it? And I can tell you real life examples. If we are relaxed when we're giving the anesthetic, it works so much better. There's definitely a mind-body relationship. When that anxiety is there, I notice patients don't get numb as quick or as well. There may be fear of the blood. Some people have a fear of blood, hemophobia. They may feel afraid or panicky about the possibility or actual presence of even minor bleeding that can happen during a dental procedure. They might fear the choking, may fear gagging or choking when the dentist numbs their mouth. They may fear not being able to breathe or swallow. And this doesn't have to do with only when they're numb. I notice sometimes with the suction, but for younger children, obviously. And that's why we have to introduce, Mr. Thirsty and the whole shebang. But they feel that, this can go down their throat and choke them. Or the cotton rolls that we put because we want to make it bone dry, the tooth, while we're working on it. Of course, we love the saliva, but not when we're working on the teeth. And that causes people to have fear. You could have a fear of the dentist. People may associate negative feelings with their dentist. These feelings may be worse if they had a bad experience with a dentist in the past. So for me, this is trust. And hence why, that relationship, I think, is core. Feeling pain. Dental procedures fairly often involve a small amount of pain. So this whole ideology about painless dentistry, I'm sorry to say, but really, I cannot say it's 100% at all. And sometimes the procedure or recovery does hurt. People who are highly sensitive to pain may be more fearful of feeling discomfort during their dental treatment or as a result of it. It could be a fear of the needle, which actually I have. I have to admit to that. People are afraid of needles, may fear the injection the dentists use during their dental procedures more than people who are not fearful. The noise. Someone may fear the noise made by drills and dental instruments used by the dentist or the dental hygienist. And over the years, I can say the noise has definitely gotten better, but still, dentistry, going to the dentist is not noiseless. And smells. People may become anxious due to how the dentist's office smells or the specific aromas that arise during dental treatment. So let's discuss some symptoms and causes. Who is at risk for dentophobia? You're more likely to develop a fear of dentists or a different type of specific phobia disorder if you already have another phobia, anxiety disorder, panic disorder, or substance use disorder. What other phobias are associated with dentophobia? Algophobia, a fear of pain. Emetophobia, a fear of vomiting. Haphophobia, a fear of touch. Iatrophobia, a fear of doctors. Trypanophobia, a fear of needles. Some of them were tongue twisters. What are the causes of dentophobia? Family history. Your risk of having a phobia increases if you have a parent or family member with a phobic disorder or anxiety disorder. You may have more anxiety than other people if you have a gene mutation. And we know this is real with most things in life. Feeling embarrassed. You may feel strange about the dentist or hygienist being so close to your face. You may also feel worried about how your teeth look and how your breath smells. Feeling helpless, the experience of lying in the chair and having your mouth open for an extended period, and that loss of control that we've already mentioned. Modeling, hearing someone talk about their fear of dentists can spark the same phobia in you. And past negative experiences. People who have had a negative traumatic experience related to going to the dentist may develop dentophobia. Traumatic experiences may include being afraid of going to the dentist as a child, having dental procedures performed without your consent, or having a procedure that caused pain or complications. And a traumatic history, of course. A history of abuse such as bullying, child abuse, sexual violence can all lead to dentophobia. Dentophobia triggers include being inside a dental office. That can trigger it the moment you walk inside a dental office. And I have met someone who's like that. They cannot actually walk inside a dental office, so we cannot even get them to come in the room. Because most of my fearful patients, I'm really fortunate to say, after the first visit, we just talk and chat and do nothing much, but just kind of, get to know each other. By the second time, most people just come put their purses down, with their wallets, their mobiles, and they're pretty ready to go. But there's very few that just cannot even walk inside a dental clinic. Hearing or seeing dental instruments, lying in a dentist chair, seeing a dentist or dental hygienist, and thinking about a dental visit. These can all trigger it. Dentophobia symptoms can range from mild to extreme. They include chills, dizziness, lightheadedness, excessive sweating, heart palpitations, the one that I said I get, nausea, shortness of breath, trembling or shaking, an upset stomach or indigestion. In addition to the above symptoms, dentophobia triggers may cause some people to cry when thinking about visiting a dentist. And I always tell patients, if you cry, I will cry. So then we have a good laugh about that. Have insomnia before a dental appointment. And that happens a lot to people the night before they don't sleep. And, when we don't sleep, lack of sleep causes us to, our pain receptors just feel more. And we're just on the, we have a lower threshold to pain. How is this diagnosed? The American Psychiatric Association recognizes dentophobia as a specific phobic disorder in its Diagnostic and Statistical Manual of Mental Disorders. Your healthcare provider may diagnose dentophobia if you experience intense anxiety or fear when thinking about or visiting the dentist. Your dentist or healthcare provider may suggest that you see a mental health professional like a psychologist. This healthcare provider can formally evaluate your symptoms, including how the phobia impacts your daily life. You may have this specific phobic disorder if your fear of dentists occurs when you think about visiting or going to the dentist, prevents you from seeing a dentist, even when you're in pain or you need urgent treatment, triggers symptoms of anxiety or fear that doesn't match the actual danger, and lasts at least 6 months. And how can I find out if my child has this? For parents, a constant fear of the dentist can be extremely upsetting for your child. If your child is very young, it may be difficult for them to verbalize what's wrong. If severe fear of the dentist greatly impacts your child's life, your child's healthcare provider or dentist may recommend they visit a mental health professional. This healthcare provider can look at your child's symptoms, offer a diagnosis, and help you form a treatment plan. But honestly, from my experience now, I've seen so many kids that I was known as the children's dentist, but I really didn't specialize in pediatric dentistry. But I can tell you guys one word, and that's patience. As dentists, we need to have patience in general with young and adults, and with children especially. And most of the time, and if you're willing to see the kids over and over again, their fear goes away. With the help of parents in the home, how they talk about the dentist and what they need to do, and of course the home care, so they don't have to see the dentist for the fillings, but more for the fun stuff. All of this is teamwork, and it can go hand in hand. And lastly, I want to talk about management and treatment. Exposure therapy is one of the main treatments for a fear of dentists. During exposure therapy, a mental health professional exposes you to situations and images that may trigger your symptoms. This exposure happens in a controlled setting where you can work through your responses. Most people with specific phobias see their symptoms improve after getting this type of psychotherapy or talk therapy. During exposure therapy, you learn breathing and muscle relaxation techniques to use before and during, view images or videos of people visiting the dentist, gradually progress to visiting a dentist's office without getting treatment, have a cleaning or checkup with a hygienist or dentist. What are other dentophobia solutions? So other techniques to overcome dentophobia include acupuncture, cognitive behavioral therapy, distraction, guided imagery, hypnotherapy, relaxation techniques, and finally sedation. Severe dentophobia often results in poor oral health when people don't visit the dentist. Poor oral health can lead to complications from diabetes, decayed teeth, periodontal disease, which is also known as gum disease, heart disease, missing teeth, pneumonia, and respiratory infections. So can dentophobia affect your well-being? I think you guys know the answer by now. Fear of dentists can have a negative effect on your general well-being. People whose oral health has been impacted by dentophobia may become embarrassed about their teeth and avoid seeing friends and family. Dentophobia can also affect their performance at work or school. Due to these factors, dentophobia can spur aggression, low self-esteem and confidence, and sleep disorders. So how can I best learn to cope with dentophobia during a dental visit? Schedule a consultation with your dentist before you have a care visit. Your dentist can tell you about the next steps. The steps are so important. We try to talk about the steps unless people don't want to hear it as a regular. I mean, this is just something common we do. This gives comfort, moving forward. And tell your dentist that you're anxious and say, how can you best help me with this? Don't hide it. They may suggest calming medications or other techniques. Bring a friend with you to offer support. Choose a dentist who listens to you and works with you to help reduce your anxiety. They can also be known as fear-free dentists. I say this with a smiley face. Come up with a signal that tells your dentist to stop if you need a break during treatment. We always have, between me and my patients, it's usually the left hand, so it's right in my vision, and the assistant can see it as well. But before that even goes up, I know myself by just the way the muscles in the face, and if they're twitching their eyes, I look at all of that. Visit your dentist at a less busy time of day, such as early in the morning, to limit the impact of noise from other patients' treatments in the other rooms. Dentophobia can lead to untreated dental problems and poor oral health. This phobia can also affect your self-confidence and relationships. Healthcare providers and your dentist can help you overcome your fear of going to the dentist. So this is a key point. Your dentist can actually help you overcome the fear of going to the dentist. Many techniques, including the exposure therapy, guided imagery, and relaxation techniques, can reduce your anxiety and improve your quality of life. So please don't stay away from us if you do have this, and actually bring it up, and there are ways around it. If we cannot resolve it here, then we'll ask for other providers to intervene. But more so than not, trust me in saying this, because I have seen so many fearful patients over my years of practice. It does get resolved here. It just takes a lot of patience. Thank you for listening in. And I know that we hadn't done a podcast for some time. Sorry, the end of the year just gets really busy with so many things. And really looking forward to a new year, a new start, and lots of great ideas for you guys out there, and hopefully more podcasts with my colleagues. Like always, any questions or concerns, please reach out to Ask Dr. Leila. Happy New Year, everyone, and talk to you in the new year.